And welcome again to the Philly Factor. I'm your host, Paul Perello. 2 years ago, if not longer, we were told that we would have to quarantine in place for 2 weeks as the country came to grips with the COVID-19 crisis. Well, here we are, marking 2 years, and we are perhaps not any better than when we were back early in the days of the start of this pandemic. Many people say that they have burnout from all of the information, over information. And a lot of people just are putting their phones down, turning off the TV, ignoring the media's calls, even ignoring politicians' calls to get vaccinated and get boosted. Well, to help us sort of come to grips with this world that we are living in today is Kelly Madden-Daly, Associate Professor, Department of Communication at LaSalle University. Kelly, thanks so much for spending some time with us discussing this bizarre world that we've been living in now for at least 2 years. So again, I appreciate your time helping us sort of come to grips with what this pandemic has done to us.
Yes, thank you very much for having me. This is certainly an important topic. And as you mentioned, it's becoming overwhelming, the amount of information that we've been receiving, and there's been confusion about where do we turn next. And so this is a very important topic.
Yeah, full disclosure here, I'm a member of the media. I've worked in the business for 44 years, and even myself, I find information overload. I mean, I'm doing this on a regular basis, Monday through Friday. And then, I find myself, drawn to the television to watch the evening news. And then after a while, it's just like enough. I can't take it anymore. And I'm sure I'm not the only one, either in the media or just the general population at large, that is suffering with this information overload. So, Kelly, tell us, a lot of people might say, I'm going to get right to the point here, that the public may feel misled only because in the very beginning, and look, nobody really knew what twists and turns this pandemic was going to take. But in the beginning, we were all told, even here at LaSalle, in workplaces around the corner, around the world, just take 2 weeks off, shelter in place, quarantine at home, and then everything will go back to normal. Here it is 2 years later, and things really haven't returned to that much normalcy.
Yes, it's true. So, and that uncertainty and that difference in messaging can definitely drive distrust of the sources that are providing that information. And often that's in part what creates this anxiety and this depression that we've been seeing when we're overloaded with these media messages. There was actually a study published in the Journal of Communication of Healthcare. They surveyed people, particularly in Pennsylvania, to find out about their sources of information and how they were feeling during this pandemic. And they found that people saw that there were these inconsistencies between what the media was saying, what the federal government officials were saying, what local officials were saying, and that led to confusion and distrust. And then that in turn created anxiety. So when we're feeling these emotions of uncertainty or these perceptions of uncertainty, that can really drive anxiety for us. And we do have this desire, like you said, to kind of turn away because we're not sure what to do. We're not sure what sources to trust if we're being presented with this inconsistent information.
Yeah. And I wonder, and part of me feels that because of that mistrust, because, the messages sort of got lost since, this pandemic started, that adds to the mistrust of people being very skeptical then about getting the vaccine and then getting boosted. And then, there's this whole movement that's out there about, the anti-vaxxers that are saying, like, we don't need to wear masks, we don't need the vaccines. And many people just find themselves between a rock and a hard place. What do I do? Who do I believe? I'm getting information on my phone. I'm watching television. I think part of it is, and I think I could say this only because I work in the business, is that this 24/7 news cycle that we have, you could watch something at 3 o'clock in the afternoon today, and by 6 o'clock tonight, that whole message has changed dramatically. And so, like, where do we go? What do we do? And they're, who are we supposed to depend on here?
Yes. And so there's been recommendations to kind of manage your media consumption, because a lot of times, watching that 24/7 news cycle doesn't actually give you more information than you need, right? And creates more anxiety and confusion. It's actually recommended, the American Psychological Association recommends you only spend about 15 minutes with COVID-19 information a day, because it becomes overwhelming. And from a communication perspective, I always recommend that you find one or two sources that you feel like you can really trust, right? That these news organizations are providing you with a lot of research. They are interviewing people that have backgrounds in particular in things like infectious disease and public health, and not simply in medicine, right? They are providing recommendations from government officials who have a lot of background and experience related to those issues, and that you turn to that one or two news sources that you feel like you can trust. And instead of trying to consume everything about the COVID-19 pandemic, that you really have to manage your media consumption and what works best for you. And we can't, at the same time, you can't just turn away from the media. That's not what we want people to do, because there's important information that's communicated by the government and health experts to the public via media. So you do have to continue to tune in, right? You do have to continue to be up to date with recommendations, but at the same time, it's best to manage how much exposure you have and what sources you're exposed to. So I think each of us really needs to take the time to figure out what are the best sources to be delivering this information, and manage the amount of time you're spending with this information. So that would be my recommendation for the general public.
This might be a broader question here, but I sort of, coming from the traditional media standpoint and having embraced social media to a certain degree, and you as a professor of communication, I find myself very frustrated with social media. And look, I grew up and worked in a business where we were constantly challenged, and still are challenged, to be responsible for the information that we're putting out there. I mean, I think that says a lot about the traditional sense of the media: radio, television, newspapers, magazines. But this whole phenomena of social media, I hate to paint with a broad brush here, but I'm not necessarily signing off that not all, but many of them don't get the social responsibility that comes with social media.
Yes, I would agree. I often tell, I worked for 3 years for a newspaper as well before I was a professor. And I often tell my students that as a member of the media, you have a huge responsibility for the way in which people respond to and how their behavior changes based on what you're reporting. And I think when you go to journalism school, that is taught to you, that you have this awesome responsibility and you have to make sure that you're reporting truthful and accurate information to the public. I've also worked a lot with vaccine communication and monitoring social media for the information about vaccines prior to the COVID-19 pandemic, about how vaccine information is distributed. And what we found through our research is that, single exposure to some misinformation, negative misinformation about vaccination can really change people's intention to get vaccinated. And so a while ago, we were recommending that we needed to flood the information environment with positive information and really prevent any of this misinformation from reaching people, because it can have a disastrous effect on people's decision-making around vaccination. We have seen some of the social media companies taking some steps to prevent the spread of misinformation related to vaccination. But it's also, it's a challenge as well to try and filter all of that information out. And there are other spaces where people are getting together to share that information as well. So it's not new that these social media companies have been that this has been a space where people have spread misinformation about vaccination, but certainly in the pandemic, it has become people in the public and people in government have become more aware that these are spaces that are being used to spread misinformation.
Yeah, and maybe it's a demographic thing, but it seems to me, and just from my perspective, that the younger demographic is more likely to get their information from social media sites as opposed to traditional sites. And I know many traditional media outlets, radio, television, have a whole component for social media. So, not to single out any one particular newspaper, but if there is a story that a newspaper is covering about the vaccine mandate, that reporter is also likely to tweet or put that story on, on social media. But my fear is that the younger demographic may not be looking. And look, I also see it in the classroom as well when I ask students about contemporary events, things that are happening today, and I get that deer in the headlights stare back because they don't know what I'm talking about because it did not cross their media feed, their news feed on their phone, and it's frustrating. But yet, I don't know if we're doing enough to sort of counsel the younger demo that news feed is not the be all and the end all when it comes to getting the information that they need.
Yes, yes. And a lot of times, not even just younger people, people in general will go to their social media feed and they'll read information, and then you'll ask them, what is the source of that information? And their response will be social media. They don't necessarily know who created that information, what source is reporting that information. And so it kind of goes back to this idea of information overload, that we see so much information that it's hard for us to remember where that information came from. And I think I tell people that another thing that's can be effective in managing the information that you receive is going through your social media feed and thinking about who are you getting information from? How is that coming to you? How can you customize your feeds so that you're getting information from more reliable sources or more trustworthy sources, rather than just getting information on social media, and paying more attention to who is creating that content. What is their background? What is their expertise? And also, what is their motivation for sharing those pieces of information?
So as we look back over the 2 years since this pandemic first broke, and we first had this collective consciousness of just how serious this pandemic was and how it was going to play out, how would you assess the media's handling of, I guess, the coverage of the pandemic and the handling of getting the information out to the public?
So, like you said, like you've mentioned, there is the traditional media, there is social media, and there are different types of traditional media too, as well, right? So print, sources that are primarily print-based. We have cable television. So there certainly have been different approaches to delivering pandemic information from different types of sources. There was one study that was published in this journal called Infection, Disease, and Health, and they looked at broadcast news videos online. And they found in the early days of the pandemic, 40% of these news broadcasts were focused on death and the death rate, and 10% were focused on how do we stop the spread of COVID-19. And so, working in news, that you're trying to create information, right? You have to be broadcasting 24/7. You have to be publishing every day or every hour now that we're using social media to get our news. And so a lot of the coverage has focused on the rate of infection, hospitalizations, and death. And that can create a sense of anxiety and uncertainty for viewers and readers. What is often more helpful for readers, especially at this point in the pandemic, or for viewers, is, what can I do, right? What can I do to mitigate the spread of COVID-19? How can I keep myself safe? What are some less risky activities that I can engage in? What are some strategies that are working, in other places, whether other schools, other cities, to mitigate the spread? Focusing more on what's working, what we've done well, and what we could continue to do well moving forward, I think is more helpful for the public than recounting the number of deaths, death rate, hospitalizations. That's important information for us to have as a public to understand the severity of the situation, especially at different points in time. But from some of the research we've seen, there could be more of a focus on what is going well, what can we continue to do that can be effective to help move us through this pandemic.
But one of the things that I've seen, and this is not just with the pandemic, but consumers of news, however they get it, whether it's broadcast radio, television, cable, newspaper, whatever, and maybe this goes to a larger problem that's out there, is that at one time the media was supposed to be unbiased. They were supposed to present a straightforward story presenting both sides of the issue. Today, I don't want to say all of it, but much of the news reports that are out there tend to slant to one side or the other. Therefore, if you subscribe to column A, you're probably going to migrate to news sources that will fill your appetite from column A. And while that may be biased to that, they're never getting to hear the other side of the story. And as I said, this might get to the bigger problem of news in general, is that, look, just take a local newscast, and most of those stories only present one side of the issue. You're supposed to, as a journalist, you're supposed to be unbiased. You're not supposed to take a stand one way or the other. I mean, would you agree that there tends to be a slant that sort of attracts the followers to that point?
Yes. So there's definitely, the echo chamber phenomenon where you attend to one news source, it agrees with your position on particular issues, and you keep going back to that source, right? Because it confirms what you already think. If you go to another source and it argues the opposite point of view, it's challenging your point of view. And so instead you turn to the one that's confirming your point of view. Most of us, that's the way we interact with media, is we turn to a source that more so confirms our point of view. There has been research looking at sources of information related to the COVID-19 pandemic, and politicians make up a significant percentage of the sources that the news media are using to cover this pandemic versus scientists and public health experts. And so the media, in a way, through the way they've been covering the pandemic, giving time to politicians to discuss this issue, you could argue have in part been part of politicizing the pandemic. And so it's something to, as a viewer or a reader, to think about, who is being interviewed by these particular sources. Are they trying to get at the science, the public health experts, or are we creating, a political conversation about the pandemic here? So that's one thing to think about. And also really to challenge yourself. And I've asked people to do this, to think about, watch different newscasts, read different sources to see what the differences are in coverage, and think about, why are those news sources covering this differently? What types of sources are they using to tell the story? What sources are being left out? And how that leads to different types of coverage based on those choices that different outlets are using or making in their coverage of the pandemic.
I don't want to put the cart before the horse here, but let's say we're in the home stretch. Maybe I'm being idealistic here as opposed to being realistic, but let's say we are in the home stretch with this pandemic. I mean, do you anticipate, or would you hope, that lessons learned over the past 2 years could be applied to communication strategies as we move forward and perhaps meet other situations that are likely, they're going to fall in our laps? So would you hope that lessons learned here could be applied to other circumstances down the road?
Yes, absolutely. And I think we're learning a lot about how to communicate with the public in times of uncertainty. All right. And so these situations are definitely going to happen in the future, where there's going to be public health crises. We're going to be uncertain about the best course to take. And how do we communicate that uncertainty to the public without losing their trust? And some research has shown that these conversations where there's conflicting information, among politicians, health experts, the media, that really breeds this distrust, and people are turning away from these sources to help them navigate these public health crises. So I think that's going to be one big lesson that we take away from this pandemic, is that we need more experts in health communication, how to communicate that information to the public, how to coordinate efforts prior to communicating plans and goals and strategies, so that there's not these inconsistencies in messaging that we're receiving, or fewer inconsistencies at least, and thinking about really how can we build trust in experts moving forward, especially after this particular pandemic, that we need to understand, why are people placing trust in certain sources? How do we build trust in expert sources so that people are following those recommendations rather than the recommendations of people that are lacking expertise to make decisions?
Would you agree in hindsight, it's always 2020, but in presenting the statistics and presenting the story or the narrative of the vaccine and COVID, is it better? It seems to me that there's only been one or two health experts that have been out in front for the entire 2 years, getting the message across, and those people have taken their share of criticism, because one day they're saying this and the next day they're saying that. But is that the right communication strategy, to stick with one, lack of a better term, talking head or two, as opposed to having all these sources out there to only muddies up the water even more so?
Right. So the idea is, that you should have consistent messaging. The more people you have communicating, the harder that is to do. But I think what we're realizing, we're even seeing stories in the media now about how health experts, they want more expertise and training in how to communicate effectively. And I think doing that prior to a crisis situation is really important. So anyone that's going to be in a significant position in a public health organization, or in a government situation where they might need to be communicating with the public, should really invest the time in training and communication and developing these crisis plans, which there is. I mean, there's a lot of available training and research related to how to manage crises. But I think as a country, as a government, state, local, federal government, it's definitely come to the forefront that training and communication is extremely necessary to be able to maintain the trust of the public. And so understanding how to communicate, and also this idea of consistency, a consistent message coming from important sources is extremely important in getting the public to buy into, this is what we need to do in this particular situation.
So might you see, let's say, back, I remember, TMI and how the media scrambled for coverage, and even how the industry sort of had to scramble to get a spokesperson out there and explain what was going on. And there have been a number of events over the course of our history. But do you suspect that this might lead to a whole new realm of careers or area of expertise, where more programs will be offered out there in the event that crises like this should pop up again, that people will be well-versed? I mean, I think they already are, but I don't think anybody ever expected a crisis of this magnitude. But in schools, whether it's LaSalle or other schools, that there might be some type of program that's in place to train the next media professionals in dealing with these type of situations.
Yes, absolutely. We've seen, the health communication field is fairly new in terms of looking at other fields of communication. And I think you're going to see more and more programs, combining with public health programs to teach these, not only the idea of how to communicate with the public, but how to communicate scientific or medical information. And so we've seen some other organizations that, like the Robert Wood Johnson Foundation, they've sponsored programs really working with journalists as well in terms of how to communicate about science information in particular. I know as someone with a journalism degree, I wasn't taught exactly how to communicate about health information. That wasn't a specialty that I received as I was training for a journalist. And we're definitely going to see more programs around that idea, because people do want someone to help them interpret health and risk information in particular. It's not easy for us to be able to assess how much risk we're taking on in a crisis or in general in our lives when it comes to health. And so people want someone to be able to interpret the information for them. They want more people to be able to do that. And so I definitely think you're going to see more programs for current journalists and also people coming into college today, whether that's in public health or in communication, a lot more focus on how do you communicate in times of crisis and how do you communicate health and medical information as well.
All right, in the minute that we have left, is there any lasting thought or advice that you can offer our viewers as we continue to, languish in this, COVID world that we're living in?
Yeah, so I mentioned it earlier, but I think it really is important for people if they are feeling overwhelmed by the amount of information, they're feeling anxiety and stress, to take a little bit of a break and to manage your exposure to this information, right? 10 to 15 minutes a day. And also think about when you're going to get that information, where you're going to get it from. Reading about everything going on with COVID-19 right before you plan to go to sleep is not a great idea, right? It could produce some stress and anxiety, lead to less sleep, right? So I think that first we need to, manage the information that we're receiving. Each of us sit down and think critically about where we're getting our information from, and how much time and energy we're spending with that and whether or not that's productive for us. The second thing that I think we need to think about is focusing on the benefits, right, thus far, that we've produced a vaccine that if you receive a vaccine generally prevents you from being hospitalized and dying from COVID. Right? There have been a lot of good things that have happened in the past 2 years in terms of development of the vaccine, understanding better mitigation strategies, and maybe developing new things to do that are COVID safe, and going back to thinking about what are some things that I can do that are COVID safe, that I enjoy, and focusing on how far we've come, and then working to get to a better place as well.
All right. Well, we'll have to leave it there. Kelly, I want to thank you for your time and your expertise. A lot of great information there. So thanks for being with us.
Thank you.
All right. Until the next time, ladies and gentlemen, my name is Paul Perillo. Thanks so much for being with us here on the Philly Factor.